Relapsing polychondritis. So, relapsing polychondritis, it is an uncommon disorder and of unknown cause. Relapsing polychondritis is an uncommon disorder of unknown cause. So, this disorder, it is characterized by inflammation of the cartilage. There will be inflammation of the cartilage predominantly affecting the cartilage that is present in the ears, nose and laryngotracheobronchial tree. So the cartilage that is present in the ears, nose and laryngotracheobronchial tree. And the other manifestations of this relapsing polychondritis include scleritis, that is inflammation of the sclera, neurosensory hearing loss, polyarthritis, cardiac abnormalities, skin lesions and glomerulonephritis. Other manifestations include scleritis, neurosensory hearing loss, polyarthritis, cardiac abnormalities, skin lesions and glomerulonephritis. So the incidence of this is 3.5 per million population per year. And the peak age of onset of this disorder is at the age of 40 and 50 years. But this disorder, this relapsing polychondritis, it also affects children and the elderly, and it is found in all races and both the sexes, both female and males, they are equally affected, and no familial tendency is present. And in this relapsing polychondritis, a higher frequency of HLA-DR4 has been found than those in patients with healthy adult individuals. So, in a patient with relapsing polychondritis, higher frequency of HLA-DR4 has been found than in healthy individuals. And approximately 30% of the patients with relapsing polychondritis, apart from this disorder, they also have other rheumatological disorders, the most frequent of which is systemic vasculitis, followed by rheumatoid arthritis and SLE. And even non-rheumatic disorders have also been associated with relapsing polychondritis. So not only this disorder, but we also have to look for other associated disorders including systemic vasculitis, followed by rheumatoid arthritis and systemic lupus erythematosus. And in most cases, these disorders, they antedate the appearance of relapsing polychondritis usually by months or years before relapsing polychondritis. So these other rheumatological and non-rheumatological disorders, these may antedate the appearance of relapsing polychondritis by months or years. So what are the other disorders associated with relapsing polychondritis? Most common association is with systemic vasculitis, followed by rheumatoid arthritis and then SLE. And the other disorders include overlapping connective tissue disease, spondyloarthritis, Behçet's disease, polymyalgia rheumatica, primary biliary cirrhosis, pulmonary fibrosis, Hashimoto's thyroiditis, Graves' disease, Crohn's disease, ulcerative colitis and myelodysplastic syndrome. Pathology and pathophysiology of relapsing polychondritis. So the earliest abnormality is of hyaline and elastic cartilage noted histopathologically. So if we do a histopathological examination, so the earliest abnormality will be seen in hyaline and elastic cartilage. So there will be a focal or diffuse loss of basophilic staining. There will be focal or diffuse loss of basophilic staining in the hyaline and elastic cartilage. This indicates depletion of proteoglycan from the cartilage matrix. In the cartilage matrix, there will be proteoglycans. So it indicates depletion of proteoglycan from the cartilage matrix. And inflammatory infiltrates are also found adjacent to the involved cartilage. And the inflammatory infiltrate, it predominantly consists of mononuclear cells and occasional plasma cells. In acute disease, even polymorphonuclear white cells might also be present. So the destruction of the cartilage, it begins at the outer edges and advances centrally. And there is also lacunar breakdown, and there also will be loss of chondrocytes. loss of chondrocytes will be present. So this degenerating cartilage, it will be replaced by granulation tissue. So that cartilage is replaced by granulation tissue and later by fibrosis and by focal areas of calcification, and there also will be small loci of cartilage regeneration will also be present. So if you do immunofluorescence studies of that material, it shows immunoglobulins and complement at sites of involvement. Immunofluorescence studies show immunoglobulins and complement at sites of involvement. And extracellular granular material observed in degenerating cartilage matrix by electron microscopy. So if you do electron microscopy, the extracellular granular material, so observed in that degenerating cartilage matrix, it consists of enzymes, immunoglobulins or proteoglycans, contains enzymes, immunoglobulins or proteoglycans. And accumulating data, it strongly suggests that both humoral and cell-mediated immunity, it plays an important role in the pathogenesis of relapsing polychondritis. So both humoral and cell-mediated immunity. So this immunoglobulin and complement deposits are found at the sites of inflammation. And in addition, antibodies to type 2 collagen and to matrilin 1. Immunoglobulins are present, complement deposits are present, and in addition, antibodies to type 2 collagen and to matrilin 1 and immune complexes are detected in the sera of some patients of relapsing polychondritis. So it says both humoral and cell-mediated immunity plays an important role in the pathogenesis of relapsing polychondritis.